So next we have Dr. Dhileesh Chandran, who will be talking on enrolling into a fellowship, the deciding factors behind it. He's currently the retina consultant at Comtrust Eye Hospital, Calicut. Over to you, sir.
Good morning, everyone. I'm Dr. Dhileesh Chandrasekharan. I'll be talking about enrolling into a fellowship, the deciding factors. So, why do a fellowship at all? So, when I joined MBBS, it was initially considered that ophthalmology is kind of an end specialty. We did not have much awareness. My batchmate John might have had because he comes from an ophthalmology family, but I used to think that ophthalmology is an end specialty, and I did not think about super specialties too much. But so it is not the case now, as we all know. So, why do a fellowship? In order to cover the lacuna in your PG training, to brush up your skills acquired in PG, and to acquire new skills. As you know, all institutes are not equal in PG training. Most of them give you a good theoretical base, but practical aspects and skill transfer is lacking in most of the institutes. Subspecialty training, supervised subspecialty training is also lacking, and the subspecialties are rapidly expanding in knowledge, and no one can remain up to date in each all subspecialties. A pan ophthalmologist is a myth. As you know, the subspecialty practice is increasing in ophthalmology. In USA, it was about 29% in 2003. It has increased to 41% in 2013, according to AAO member surveys. When to do a fellowship? Soon after PG, if you do, you're fresh with your knowledge, and maybe you can do better in your exams, and there is no break in your surgical training, and you may have good references from your consultants. And but the caveat is that you may not have any time to consider personal life or building a family. If you go for it after a break, you may get um, uh, time to compensate for inadequate surgical training which you had in your PG at a charitable institute, or it even gives you time to introspect about your subspecialty of choice, and maybe make a little money for financial stability, and also maybe build a family, have a few kids. Where to do? At a large institute, the advantage is that there are many faculty with specific areas of interest. Especially in retina, one may be interested in ROP, one may be in diabetic retinopathy, one in oncology. So different points of view are always helpful, and you will get to see multidisciplinary approach. For example, I was in Shankara, I could see a case of Boston keratoprosthesis who developed an endophthalmitis, and I could see how it was being managed by the vitreoretinal surgeon. So this kind of multidisciplinary approaches can be seen only at uh, large institutes, and you get opportunities to teach, and rigorous academic exposure and exposure to research, which is also very important for your career, and of course the brand value for your CV, and you will have more call duties and maybe less time for your family at a large institute. But in a smaller practice, you may have a closer mentor to mentee relationship, and maybe because of that, more surgical exposure, lesser call duties, and you can have a little exposure to comprehensive ophthalmology patients as well. One thing I have to tell you is that don't base your decision solely on cutting, as they say. So people keep asking you how much cutting will you get. So more important than that is supervised training. So I would tell you, my mentor, Dr. Rupak Roy, he would when maybe in a buckle, he would let me localize the break and do cryo, and then he would descrub and go out, and then let me pass the buckle, and then when come back again, scrub again, and then see how the buckle is, and then let me drain. So he scrubs out and in twice for the same case. That kind of mental commitment is what you need. That kind of supervision is what is more important. I may have done only 2 or 3 entire buckles in my entire fellowship, but this kind of supervised training gives you more confidence. So that is what you have to look for, rather than number of cases. And attend subspecialty. How to decide which subspecialty? Attend subspecialty ICs and video sessions at conferences like this. Watch YouTube videos, webinars, and consider short observerships at an institute of practice. And don't jump into a subspecialty because you are not exposed to it. You don't have retina in your hospital. Don't take retina for your fellowship because you are not exposed. And that elusive thing called passion is what you have to find, and you have to consider the final destination, as Dr. John said. So where you want, you if your final decision is to go back to your small town in Wayanad and set up a practice there, it does not make sense for you to take oculoplasty or pediatric ophthalmology. So maybe you should take comprehensive ophthalmology plus a little bit of medical retina or something on the sides. And if you have a strong back and don't mind long surgery, we are in Plasti maybe for you. If you want to continue comprehensive ophthalmology, consider shorter fellowships like medical retina and phaco. If you are interested in charity, maybe comprehensive ophthalmology is for you. And money, as the cliche goes, maybe not. And while preparing, you have to prepare a good CV without any mistakes, especially spelling mistakes. And you have to you have to be up to date about the recent advances in the subspecialty. That's what they always ask in fellowship interviews. And check out the recent publications from the institute you're going an interview for, and reach out to recent fellows, and general instructions like well groomed and everything that goes without saying. And have a plan for your fellowship. You have to have a financial planning, how to deal with family separation, how to deal with your kids, and some skills have to be acquired prior. For example, if you have a medical retina 3-month program that you have to attend, you have to have certain degree of indirect ophthalmoscopy skills before you join. So if you don't know indirect ophthalmoscopy and you join, and you will take 2 months to know indirect ophthalmoscopy, then you have very little time to learn. So basics have to be covered a little before you join for a fellowship. The fellowship out and information is freely available online these days. There's a information booklet that you can find in eOphtha. It is freely available. Almost all fellowships in India are covered in this, with contact information and everything, interview timings and everything. And if you join Young Ophthalmology Society of India, you also have access to YOC Fellowship Help Desk, who will guide you, give you information and guide you in choosing your fellowship. Thank you.
Thank you, Dr. Dhileesh, for that extensive talk on all the options for a fellowship. And thank you for stressing that you don't jump into a fellowship because you are not exposed to it in PG. You have to find your passion, because many times, many people, they just say, okay, in PG I have been exposed to all of these, and then okay, maybe vitreoretina surgery, but it's a different world. So you have to experience everything. You can maybe observe some specialist before you join a fellowship.
No, that's a good idea.
Thank you, Dhileesh.